Guys, it's Savannah, and today we're going to talk about 10 ways breastfeeding can go wrong and how you can fix them. Being a parent is always hard, no matter the circumstances. And sometimes, as parents, you want to do what's best for your child. Breastfeeding is usually the best way to feed an infant because it helps protect the mother and infant from a variety of health problems. Even so, many women who start out breastfeeding stop before the minimum 6-month mark. Many problems breastfeeding can be asked at your local pediatrician's office. Make sure to check out omegapediatrics.com for great cultural sensitivity care. So the problems, are you worried about overproduction, feeling under the weather, tired of sore nipples, knowing that the sore nipples is not the cause of your pain, you can't really easily extract the milk, you have allergies, you're taking medications that you're concerned that are going to affect the baby, are you drinking enough liquids and or fluids, worried about your coffee in the morning, all that caffeine can't be good for the child. Or do you feel like everyone's watching you when you're trying to breastfeed? The lack of support some mothers feel while trying to breastfeed is monumental. Having such controversy over public breastfeeding while any mother is just trying to feed her child is stressful. Not only do mothers deal with side eyes publicly, they also have to deal with the scrutiny online. So here are some solutions. Here are just some things that you can do. With milk oversupply, you can nurse in the upright position, use your fingers to reduce the flow of milk, give the baby control. Let the child interrupt feedings, burp him more often than you usually would. Avoid pumping, and applying cold water and ice to the nipples can decrease leaking. Feeling under the weather? Well, very few viruses can pass through breast milk due to the antibodies that are naturally produced. However, if you are HIV positive, you should not breastfeed your child because this can and will pass along to your child. So, sore nipples are the most common complaint in new mothers. Always be able to differ from soreness or nipple pain. You can usually tell the difference between normal nipple sensitivity and pain based on how the pain or soreness changes over time. Normal sensitivity will subside 30 seconds after breastfeeding begins. Some ways to prevent and deal with a plugged duct is try to position the baby so that his chin is near the plugged area. You should not quit breastfeeding. This will lead to engorgement and worsen the problem. Try taking a warm shower, then massaging your breast from the outer part towards the nipple to try to decrease the blockage. Take a mild pain reliever and also make sure to always check in with your doctor. Remember to feed frequently, enough so that your milk production doesn't slow or stop. Don't be separated from your baby too long, and don't give up breastfeeding and feed formula, then try again to breastfeed. Babies may have a reaction to something the mother eats. Symptoms of an allergy from the mother's diet includes diarrhea, rash, fussiness, gas, dry skin, or the baby pulling up their legs and screaming. The problem will usually go away on its own if you can identify the allergy and stop eating that particular food. Always check with your healthcare provider before taking medicine. Take the drug just after nursing, and that can decrease the exposure of the medicine to the child. Women tend to think that a lot of fluids leads to good milk supply, which is untrue. A nursing woman does, however, need to drink enough fluids to stay well hydrated for her own health. Results from studies show that 5-ounce cups of coffee per day can cause the baby to be fussy and not able to sleep well, while fewer than 5 cups a day usually doesn't cause a problem. As always, thanks for watching. Make sure to check out the full article, 10 Ways Exclusive Breastfeeding Can Go Wrong. This video is brought to you by Omega Pediatrics. Make sure to check them out. Thanks.